Hello everyone, my name is Hannah Olson, and here today I'm going to teach you how to do a blood pressure. Now there's many different ways that you can do it, but the way that I'm going to show you today just calls for a blood pressure cuff and a stethoscope. This is the way that you'll see it mostly in doctor's offices and at hospitals. The blood pressure cuff, as you see, there's the cuff that goes around the arm, there's the gauge that has the readings, the balloon pump to pump up the cuff, and this is the dial. When you're doing the blood pressure, you want to make sure the dial is closed tight while you're pumping it up, and then you let it out ever so slightly to let some of the air out. So you want to find a cuff that will fit the person's arm very well. It should cover approximately 80% of the arm. So first thing I'm going to do is I'm going to feel for her brachial artery, and that will be on the inside of the arm, like opposite of the elbow. So I feel it right here, and then on the blood pressure cuff there will show you where to match up with the artery. It usually says artery on it. So you're going to match up the inside of this cuff with the brachial artery about 2 inches above the artery. You want to make sure it's fit snug, because if you have it too loose or too tight, it can give you a false reading. Then you're going to either feel the brachial artery or the radial artery. You want to make sure your dial is close tight again. And first thing I'm going to do is I'm going to pump it up and feel for when I feel the pulse stop beating. So we'll pump it up. A good blood pressure runs approximately around 120/80. So right there I felt it around 120, so I'm going to deflate it again. Make sure it's good. Deflating, and then you want to give the arm approximately 15 to 30 seconds rest to make sure all the blood starts flowing through your arm again. And then when I pump it up the second time, I'm going to pump it up about 20 to 30 more than the 120 that I just got. This is when the stethoscope will come in. You put it in your ears, and you're going to use the diaphragm and place it on the brachial artery to listen for the beat. So I'm going to put these in my ears. Once again, make sure your dial is closed tight. I'm going to place this on her artery. I'm going to pump it up again, and what you're listening for is for it to stop beating again. So I'm pumping it up to approximately 150 to 160. And then it stops. So I'm slowly going to start letting the air out of the cuff. And then you're listening again for when you hear the first beat and the last beat. So I'm going to be quiet for just a minute so I can listen. Alright. So I heard the first beat at 112 and the second beat at 72. So that is overall a pretty good blood pressure. Like I said, there's many different ways that you can take a blood pressure. You kind of wonder, when will you ever use this in your life, and why do you need to take blood pressure? But blood pressure is very important, and you can actually get a pump at maybe Walgreens or somewhere like that you put on yourself, and you push a button, push start, and it will pump it up and tell you the reading without having to use the stethoscope in the cuff. But this is a good way because sometimes the pumps are off and not calculating right. So this is more of an accurate way, I feel, to take a blood pressure. So thanks for listening. It was nice to see you all.
Were you supposed to